Hi, this is Krista Moore, and welcome to the Krista Moore Show. As you know, I like to interview industry experts and thought leaders on ideas that are important to your health and your wellness and your business success. And today is a different subject, but it's something that I'm hoping you all can have takeaways from to better understand a concept called music therapy. And I have a clinician, and he understands music therapy, and he's going to share his thoughts and ideas and impact. And this is my cousin, Craig Gillespie.
And this is my cousin, Krista. I'm so happy to be here. Thank you, Krista.
Yeah, so I wanted to make sure that we took this opportunity to share with you this wonderful concept. I understand it about this much, so we're going to learn together. And then he actually has a wonderful song that he's going to perform for us. So make sure you stay tuned for that.
Thank you.
So why don't you first describe for us what exactly is music therapy?
Sure, that's great. So this is the best definition for music therapy for all you listeners is using music clinically to help people. So that's a really broad definition, but oftentimes music therapy, it's a clinical practice. So it's clinically grounded, requires education, research to be valid. And with that clinical grounding, there's a national association to keep it valid and as a true credential. So the general definition, again, is using music clinically to help people with disabilities or some kind of problem from the very beginning of the lifespan to the very end of the lifespan. So that means for mothers who are maybe experiencing some difficulty with
Like
their
postpartum
baby,
or something?
Yeah, postpartum or even pre-delivery. What is that called when mothers prenatal? Thank you. So it's actually can help mothers in the delivery process, and it can help end stage. What's really amazing music therapy work is working with Alzheimer's patients. How music can get into the brain in a way that can retrieve the people that are lost from the dementia and it reignite them and bring out the full person that was once there through the music stimulation.
Yeah, I think it's wonderful. And I think what is even more fascinating for me is that this is your chosen profession. And I often talk about finding purpose and passion, and whenever you're able to bring those two things together, you really can soar in your profession, in your life, and in your career. And you've done just that. So give us a little bit of a backdrop on why music, became such an important part of your life.
Thank you. That's great. And this is great because Krista has this show, and I'm so privileged again to be on it because her family and my family share a musical connection. And our grandma was Grandma Gillespie, Sarah Gillespie, was very into the organ and singing hymns on the organ. And so my dad, Krista's mom's brother, Jim, was a bass player and a really good bass player. He played jazz very well. And he married my mom, Western Pennsylvania roots. And my mom was a singer and her brother Don was a piano player. So a musical family, there's musical intelligence, different intelligences are genetic. They can be passed along. So I had that musical gene, and I'm very glad to have had that. It's my gift and it's my passion. But I didn't follow that path for the first 30 years of my life for various and complex reasons that I won't get into. But around my 30s, I did decide, what I was doing wasn't quite working out. So I found music therapy as something to look into. I did some interviewing, and then I got into NYU, which has a master's level music therapy program. I got accepted. I had to audition, and voila, here I am years later. So
yeah, it's wonderful.
It's right up that line with finding your passion, because otherwise I might have missed it and just done something to make a buck.
And it's passion, but it's also recognizing those gifts, those inherent kind of God-given gifts, and how can I use that in my everyday and give that gift back. And what I see music therapy does is an exchange of a gift. You're being of service to your patient and being able to really have an impact in their world based on how they're receiving and hearing the song, the music. And I just find it fascinating.
Right. Thank you. I think that the thing I want to say is there's many different styles and practices of music therapy, but how it works is people have to go through, first of all, they have to take an achievement test after they've gotten a degree in music therapy. There's 2 different levels of clinical practice, which is a little confusing for people to understand. And that's one, I think it's a house cleaning effort that the profession of music therapy has to clarify, because there's a bachelor's level and there's a master's level. But the credential for either a bachelor's or a master's is a music therapy board certified, MTBC.
Okay.
But it is a clinical designation, and it's a good credential. And it's not easy to get because you have to do 1,000 hours of internship in a clinical setting. You have to pass an achievement test, which is quite difficult, and you need that degree. So you've already had to graduate, do the internship, take the test. That gets you board certified.
And then you have to keep that certification.
You have to keep that certification. The certification
education
period lasts 5 years. And so after 5 years, one has to get the appropriate number of credits through their practice and taking courses and staying alive with, staying current with all the trends to recertify, versus if you don't have enough credits, you have to retest. And who wants to take a test again, especially at my age? So I luckily got recertified recently, yes.
So I'm curious about where music therapy is being used, like in what institution, or is it more in hospitals? Is it in elder care? Where do you see it surfacing?
And that's a really good question. I think a lot of it depends on the region people live in. In more urban areas, where there's big vital cities, there's a lot of hospitals that have music therapy. It's through the nation. The National Music Therapy Association has, I'd say there's 4,000 to 5,000 music therapists in the United States. And generally they should be part of that association. And so the setting depends on the locale. Bigger cities have music therapists in hospitals. They have them in schools. They have them in special ed centers. Where the kind of work I do is with psychiatric patients, so behavioral health. I've worked with autistic kids in the past, so it's just a broad array of where music therapy can be done.
Help me understand how it's delivered. Is it one-on-one with the patient? Is it through words or music? Is there certain instruments that are more commonly used than others?
That's okay, great. So the quick answer to a complicated question is it can be delivered in groups or it can be delivered one-to-one. So to talk about what I do is I work in oncology. I work on a cancer unit in a hospital, and I do bedside work with patients. So they're oftentimes getting treatment, they're in pain, they're struggling, they're having an existential crisis. What does this mean to have cancer? So I use both counseling and then I use music, and mainly I do songs that they want to hear, and I'll alter the songs clinically to make it appropriate for what their needs are. Sometimes I'll spontaneously change a verse. Sometimes I'll allow them to write a verse with me, but it's all for the interest of improving their health, right? Because there's global problems with one's health when they're faced with cancer.
So how do you know that you're actually having impact?
That's a great question. Through what the patient says about the intervention, what their family says, what the clinical staff that you're working with says. And then looking at the research, how do you measure that? Because music is one of those things that's hard to measure. Like when people talk about, I really like that song. Well, what does that mean? If you have a favorite song,
how does that song make you feel?
Right. How does it make you feel?
Or what kind of emotion is it bringing up, or you're remembering?
Right. And so if anybody out there thinks of when they were 12 or 13 years old and they maybe remember who their first boy or girlfriend was, what was the song you were hearing at the time? Music has a way of bringing up associations that are very powerful, kind of like the olfactory sense. When you smell something, and that brings up what's called an association in your brain. So music gets highly embedded in the brain, and that's why,
interesting.
That's why it's so powerful.
It makes me think of the movie The Notebook, which is like one of my favorite movies. It was a Nicholas Sparks film, and they would dance to a certain song. Are you familiar with the movie?
I'm not.
Oh, you have to watch it. You like it.
The Notebook.
The Notebook, yeah. It's a classic. and they grow old together. And she had dementia, but when he would play a certain song that they used to dance to when they were younger and in love, and when she was, perfectly fine, she would almost come back to herself. And that's just, that would be music therapy.
Right.
That's how I would relate to that.
There's a neurologist named Oliver Sacks, and he's written several books, but he's a neurologist. He's a medical doctor, and he's a big proponent of music therapy. He worked with one of my internship directors at Beth Abraham in the Bronx. Her name is Connie Tomato. Connie, if you're out there, hope you're doing well. Connie plays a mean accordion, and she does really good research with older Alzheimer's patients and how music can help them. But that's a great point, because one of Sacks's books is The Man Who Mistook His Wife for a Hat. He talks about people with extreme advanced Alzheimer's that basically are wheelchair bound, but if they hear a song, they could suddenly get up and dance if they were younger.
Gave me chills. Yeah,
it really is. It's that powerful, and that kind of power can be used clinically. The challenge for music therapy is that there's not, carte blanche buy-in from all doctors. So that's one of the things about the creative arts therapies that really is, both a challenge, but also a good thing, because there's different ways to look at health and how we can all improve our potential as human beings. And it doesn't have to be reductionistic and about, how clinical trials are done to test a medicine.
Sure.
That's a lot of what medicine looks like. It's pathology driven rather than wellness driven.
Yeah. And so the creative aspects of it are a part of the more wellness driven, I would think.
Right.
But at the same time, that doesn't make it less legitimate.
Right.
But yet,
worldly,
it might seem like woo-woo or...
Right, it might seem like, okay, well, so great, the guy played drums with patients in a behavioral health hospital. That's one of the things I did in my clinical practice in behavioral health, is I'll do percussion groups. A lot of people know drumming circles, but when you drum, you actually are using both hands, if you're using both hands, and that can engage both parts of the brain. And for people who are struggling with severe mental illness, that's a different way of communicating. It doesn't mean different is worse or less important than a talk group, because groups are really important.
But it's activating different senses for that individual.
Right.
Yeah.
And it also gives them success in a different way. Even if it's a limited success by drumming with others, people can really get into that.
Yeah.
And if they're having a hard time accessing their brain on how to talk about their experiences, especially if they're significantly ill with mental problems, having a successful experience by hitting a drum and knowing that that was successful,
and you made music.
Right. It doesn't, it's what is success, right? You look at what is meaningful, what is successful for people, and that's how you measure it, really, because if you're improving the quality of life, it's successful.
Well, and also I think it's important to note that in addition to being a music therapist, you are a counselor.
Right.
Yeah.
Thank you.
You're kind of tying those things together.
Right. Right. I'm a mental health counselor, and I have a license in that, and I'm a music therapist, board certified. So I blend the two. And it's good to have a blending, because sometimes you need to process the experience, like after I do a song. So certainly with cancer patients, they need to talk about what's going on for them. And then, you can talk about what does it mean to live with cancer, go through chemo, deal with the pain, deal with the family struggles that people undergo often.
And I would imagine in that circumstance, the music component could just be the relaxing piece to get them to open up to a conversation.
It could be, yeah. Thank you, for saying that, because they're in a medical, imagine if you're in a cancer floor, you're surrounded by medical technology, right? You're just, and now with COVID going on, a lot of people are like, even more masked up.
That's right.
And it decreases the humanity of the contact. So in walks a guy now with a mask, but with a guitar, and it's a different context. It's like seeing a chaplain. A chaplain comes in not to take your blood pressure, not to talk about the illness, but to talk about spiritually what's going on with you. So, I think a great way to look at health overall is there's 5 domains. There's the cognitive, there's the emotional. So both those kind of take place up here, but the emotional is also here. There's the there's the physical, there's the social, and then the spiritual.
Okay.
Right. So you break that down, and you can look at how music can affect all of those. Right.
Yeah.
So another great application is people recovering from a stroke. There's been research done on march music to kind of get their gait when they're learning how to walk again. So music therapists can work with physical therapists. So multimodal approach to blending things is also going on. So there's a lot of potential for, again, using music therapy to complement other modalities of treatment.
So I'm thinking about the one that's receiving this, okay, the patient, but I'm also conscious about you as the individual who is the therapist delivering it.
Interesting.
And my mother, you know well, and she had a beautiful voice and she loved singing. And she told me before her passing that I should sing because, and she always said she felt so great about herself when she was singing. And music was really important to her, but it was her gift. And she would always sing in the church choir and sing whenever she could in different groups and arrangements. But it was how it made her feel to be able to give that wonderful gift back for others to hear. So how does it make you feel to be the one delivering music therapy?
Wow, that's a tough question. I like it. So that's part of the training music therapists go through. When you're dealing with people with disabilities, they're not always in a great place.
Yeah.
For instance, children with autism, they don't know how to communicate. If the autism is a spectrum illness, if it's a significant degree of autism, they might want to throw something at you when you're one do music therapy with you.
Yeah.
So some people, if they're struggling with cancer, they're not feeling well. Oh no, I don't want to deal with that. Thank you, but no thanks. So you have to have a lot of resilience. You can't take things personally. But when you connect and when the connection works, and you know you've gotten in there through the music,
you can feel it.
You can feel it. So getting back to the training, music therapists have to be conversant with a guitar, a keyboard, and they have to sing.
Okay.
They can also have as a primary instrument a cello. There's some wonderful musicians who are music therapists who are amazing instrumentalists with a primary instrument than those three.
Yes.
But they have to be conversant in all those three modalities.
Well, you have your modality here, or your favorite modality.
Yes.
And I've heard you sing many times through the years. And I am hoping that you'll share something special with our audience today.
Well,
why don't you give us a little bit of a background on this particular song that we're going to be able to hear from you.
Thanks, Krista. This is such a special opportunity. So I work on an oncology unit, and I work there part-time, and an oncology unit delivers very special care, and the nurses I work with are very special people because they deal with life and death issues, and they're very important deliverers of medical service from the doctors. So they're talking to their patients about really tough stuff, and the patients therefore blend with them in a way that could be different from other nurses in other med-surg environments. So I got to know the nurses quite well, and there was a nurse named Cindy who was working and a great member of the team, because teamwork is so important in medicine. And Cindy gave her notice she was going to leave. And she was one of the first people when I started on the oncology unit who was really just so welcoming and said, "Craig, it's nice to have you. What can I do? Anything to help you learn how to do music therapy in this setting, just talk to me." So when she gave her notice, it was no small thing.
Yeah.
So one of the things that music therapy could do is help not only the patients, but it can help the staff members in processing something like losing a valued team member. So spontaneously, I've been a guitarist since I was 12, and I played cello and all kinds of stuff. So music is my thing, right? And I'm so glad that I went to NYU in my 30s to get that degree and be a music therapist. But with the creative process, I'm going to reach for my guitar now. What's wonderful, this is more the musician side of me, the songwriter side, is songs can kind of emerge. And so in thinking about Cindy, I just came up with this song. So one little nerdy thing I'm going to say is
so excited. I have not heard this yet.
Lullabies, as you know, are in triple time, right? So this one is not in triple time, it's in 6/8. So that sounds a little complicated, but this is a holding song, and it's also a song for staff members that worked with a valued team member to kind of, have a symbol to represent who they worked with, what it meant. And then after they hear the song, they can share their own feelings. It's not about my song, it's about the song being a vehicle to open up
that
what that is. So this is called Turn Back Again. And then I'll just say a little more after I'm done playing for y'all.
Great.
I first knew you moved in a flash. Your hair honey blonde with the curls down your back. Your smile was a light beam, your words soft and kind. Now that you're leaving, we may all lose our minds. So turn back to us again. Turn back to us again. If only in your mind. Turn back to us again. Turn back to us again. Laughter fills the hallways as the nurses switch beds. The pace of their work can make you wish you were dead. But then all the joking will vanish as the charges they find. Oncology nurses are one of a kind. So turn back to us again. Turn back to us again. If only in your mind. Turn back to us again. Turn back to us again. Cindy, you're leaving, we can't make you not go. But your person's a beacon in this hard road we hold. I hope you remember that in my mind's eye you'll always be star of this show. Turn back again. Turn back to us indeed. When I first knew you moved in a flash. Your hair honey blonde with the curls down your back. Your smile was a light beam, your words soft and kind. Now that you're leaving, we may all lose our mind. So turn back to us again.
Yay! That was great.
Thank you.
Thank you so much.
Thank
for
you,
sharing
audience,
that.
for letting me share that.
That's awesome. So
First time I've ever done a song on a show like this, and I'm privileged to do that with my loving cousin, who I admire so much, and her show. So thank
That's
you.
great. Thank you. I'm so glad we have it recorded now because you have it forever.
Oh, well, and I hope I did it all right. I think I did. I don't think
It
I screwed
sounded
up.
awesome. Thank you. I'm so proud of you.
Oh, thank you.
Yeah. And you know what I just love the most for me is that you have discovered your purpose and your passion, and you're able to live that every day. And it shows, I feel it.
Oh,
Yeah,
thank
it's
you.
wonderful.
And there's so many good music therapists out there that do their own unique blend of work, because music is personal. So how does the therapist feel? They feel when they connect and when they do the work. If it's promoting wellness and meaning, then it's making a difference. And so making a difference with you, Krista, and with the people that may take something away from this means a lot to me. So thank you. I want to thank you again.
That's great. Thanks. Well, it was terrific having you today. And this was a special kind of interview because we're family, and I'm able to also bring to the audience this idea and this concept of music therapy that hopefully we all have learned from today. So thanks.
Thank you.
Thank you. I blow kisses. Bye-bye.